Welcome back to Medically Speaking-ish. This is our 4th episode, and today we're diving into a question patients often ask us. Doctor, is this true, or is it just a myth? We'll look at 5 controversial claims in medicine, separating hype from evidence with the latest data. Let's begin with intermittent fasting. Many of our patients come in convinced that fasting is superior to standard calorie restriction for weight loss. The reality is more nuanced. Several randomized trials, including those in JAMA Internal Medicine, suggest intermittent fasting works, but mainly because it reduces overall calorie intake. In head-to-head comparisons with daily calorie restriction, weight loss and metabolic outcomes are similar. So, while fasting can be effective, it is not a magic bullet. Adherence and sustainability matter most. Now, artificial sweeteners. Some headlines claim they cause cancer, while others insist they are safe. The World Health Organization recently flagged aspartame as a possible carcinogen, but large cohort studies have not shown a consistent signal. The bigger concern may be metabolic. Some evidence links artificial sweeteners to insulin resistance and changes in gut microbiota. Clinically, the take-home point is moderation. For patients struggling with obesity or diabetes, replacing sugar with non-nutritive sweeteners can still be a useful harm reduction tool. From sweeteners to smoking alternatives, let's talk about e-cigarettes. Many patients ask if vaping is safe. The evidence shows e-cigarettes are less harmful than combustible tobacco when it comes to cancer and pulmonary outcomes, but they are not harmless. Recent data show endothelial dysfunction, increased oxidative stress, and rising cases of e-cigarette-associated lung injury. For clinicians, the messaging should be, vaping may help transition away from cigarettes, but it should not be framed as safe. Another common belief is that high-dose vitamin D supplements prevent all-cause mortality. This myth exploded after observational studies suggested vitamin D deficiency was linked to everything from cancer to depression. But when randomized controlled trials put it to the test, including the VITAL and D2D trials, the protective effect largely disappeared. Vitamin D remains important for bone health and deficiency states, but megadoses for prevention of chronic disease are not supported. Finally, probiotics. The market is booming, and many patients think probiotics can fix the gut. The evidence is highly strain-specific. In irritable bowel syndrome, certain preparations can modestly reduce symptoms. In inflammatory bowel disease, the benefits are inconsistent, and in post-antibiotic diarrhea, some strains reduce recurrence. But the blanket claim that probiotics are universally beneficial is overstated. For clinicians, the key is individualizing recommendations based on indication and strain, not general hype. So what's the bottom line? Fasting works, but not better than calorie restriction. Artificial sweeteners are probably safe in moderation, but not risk-free. Vaping is less harmful than smoking, but far from harmless. High-dose vitamin D doesn't prevent chronic disease, and probiotics help in specific situations, but not all. That wraps up episode 4 of Medically Speaking-ish. Our mission is to cut through noise, challenge myths, and deliver evidence-based insights for clinicians and medically curious listeners. If you found this useful, subscribe for more, and share this with colleagues who like their medicine mixed with a little myth-busting. Thanks for joining us, and see you next time.